I'm Laura Wright, and I'm going to be irrigating through a nasogastric tube today. So the first thing I want to do is verify my physician order for the frequency and the type and the amount of irrigation. I'm going to go ahead and get my equipment together and ready and wash my hands. I'm going to identify my patient using two different means, their name and date of birth, and once they've told me those, I'm going to use their wristband to compare it to their information, their documentation. I'm going to be explaining to the patient that we are doing an irrigation through their nasogastric tube today, and I'm going to make sure that I provide privacy for them. I can go ahead and put on my gloves, and I'm going to check the placement of this tube through aspirating stomach contents to make sure that it is 4.0, so clamp and then put this. And once I've aspirated, clamp again, I'm checking the contents. It is 4.0, we are in the stomach. You may not have to aspirate. You could check by measuring the amount of tube out of the body and the markings on the tube. So now I'm gonna go ahead and re-clamp this, and that's why I can go ahead and get my 30 mils of saline drawn up. Unclamp, and I'm going to insert the saline, and once it's unclamped, I'm going to run it through. You want to make sure that you don't insert anything into this blue tube. So once I've inserted the saline, I'm going to go ahead and aspirate, and if your aspirated amount is greater than what you instilled, this is your output. Your intake is if your aspirated amount is less than what you put in. So I'm going to take this off and clamp, and I'm going to get a new syringe and draw back on my plunger and just insert some air into the blue vent. And I want to make sure to position this above the stomach. So once you've inserted your air into your blue vent, you can go ahead and reconnect this to suction. So once that's reconnected, I'm going to take off my gloves, wash my hands, and make sure that my patient is in a safe position with the bed down, the rails down, make sure they have their call light and that they know how to use it. And I'm going to make sure that any of the solutions that I removed are measured and documented, and I've washed my hands, and I'm going to, at this point, go ahead and assess the patient's abdomen, and I'm looking at it through inspection for any signs of distension, any areas of concern. I'm going to listen to each of the quadrants for at least 2 minutes, 5 minutes if I don't hear anything. And I'll palpate the abdomen to feel for any abnormalities, and wash my hands, and I'll go and report and record my procedure. So now I am going to go ahead and remove the tube. So I'm going to verify the order that the physician has placed in order to have the tube DC'd. So I'll go ahead and wash my hands and identify my patient using two different methods, their name and date of birth, and once they tell me that, I'll compare their wristband to their patient documentation. I'll make sure to provide for privacy, and I'm going to explain to them that we're going to go ahead and take out the tube today. So at this point, I will assess the patient's abdomen first through inspection, and I'm just looking at the abdomen to make sure there are no signs of distension or any areas of concern, and I'm going to listen to each quadrant for at least 2 minutes, 5 minutes if I don't hear anything. And I'm also going to palpate the abdomen. That feels good. I want to make sure that the patient is minimal 30 degrees up in the bed, but ideally up to 45 degrees. I'm going to go ahead and wash my hands and put on a new pair of gloves. And we can go ahead and turn off the suction and disconnect the tube. So once we've disconnected the tube, we're going to go ahead and irrigate the tube with 20 mils of air with our new syringe. So once I've inserted the 20 mils of air, I'm going to go ahead and clamp the tube, and we're going to remove the tape. And I'm going to try to pull out the tube quickly and slowly. Quickly and smoothly. And so I've clamped the tube and I'm removing it. And I'm going to take this and dispose of my tube. And this is when I can go ahead and provide oral care and nasal care. And then I can remove my gloves and wash my hands, and I will go and report and record my procedure.